Hello, I am Dr. Vispi Jokhi, orthopedic surgeon and the CEO of Masina Hospital. Masina Hospital is located in the city of Mumbai, Baikala. Well, in the charitable hospitals are governed under the Bombay Charity Trust Act. And initially when the healthcare industry started, most of the hospitals were either in the public sector or in the charitable trust hospitals. Now, for a long time, the charitable trust hospitals were almost working in tandem with the public sector, and public sector hospitals being very overcrowded and where the infrastructure and the quality of treatment was poor, the middle class and the other people who would not like to go to the public hospitals started coming to these charitable trust hospitals. Over a period of time, when the cost of healthcare started increasing and the technology started increasing, many of these charitable hospitals started upgrading their facilities and created a model where they would have patients who could pay, and that could sort of sustain the charities. However, after some time, many hospitals lost track of their actual aims of charity, and the public perception, these hospitals came to be looked upon as more of a profit hospital rather than charitable hospitals. So as a result of this, there was a lot of hue and cry in the public, and people thought that hospitals were more for acquiring profit and were not really serving the charitable objectives. And therefore, the High Court clamped down on these hospitals and created a scheme whereby beds were to be reserved for charity purposes, and we were supposed to display that these beds are available for charity purposes. So therefore, and in that context, the scheme which was there provided free treatment for people whose family income was less than 85,000, which was called the indigent category, and it was also 50% cost of treatment was to be incurred, 50% discount was to be given to patients who are from weaker sections of society, which are called the weaker section patients. So that is the way this whole scheme went on. Today, many of these hospitals are fulfilling this criteria and some are not. And therefore, there has been a bit of a reaction from the people at large. Yeah, Masina Hospital comes under the charitable hospitals, and it is governed by the Bombay Charity Trust Act of 1950, and we are a non-profit, whereby whatever revenue we earn is plowed back into improving the infrastructure and into actually giving services to patients again. Yeah, we are the oldest private healthcare setup in the city of Mumbai. We predate Harkisand's Hospital and Pasi General Hospital, which were which are among the very old institutions in the city of Mumbai, and many of the hospitals came much after us. So the hospital started with a humble, with an individual, our founder, Mr. Hormasji Masina, who in the year 1902 decided that he wanted to serve the public, and initially the persons who are prominent in the field of health, in the charitable field, like David Sassoon and Sir J.J. Took notice of his work, and David Sassoon, who is the owner of this particular place in which we are sitting, gifted his house to our founder Hormasji Masina to run a hospital. Subsequently, in those years, for a sum of 25,000, the whole property was acquired, and over the period of years, many years, various other buildings and structures have come up in this hospital, which have resulted in this hospital now being about 270-bedded hospital, which is a multi-speciality hospital. Along with this, we are into all the normal areas of healthcare, but we are also specializing in burns care and psychiatric care, which typically are not the very lucrative and the profitable sectors of healthcare. Yes, the challenge of cost of healthcare has been there in terms of maintaining a good infrastructure and also maintaining good equipment and providing the best care to the patients. We are helped in this regard by the fact that our trustees and our donors are have given us a lot of support in terms of improving and enhancing our infrastructure. Along with that, various charitable trusts like Rotary clubs and all that have found in Masina a destination where they could give us a lot of support and donations in terms of equipment, because they see a synergy in their aims and objectives and in our working methodologies. And it is only because of this capex expenditure which is being met by these various donations and the equipment coming at low cost to us, that we are able to continue giving services at rates which are at least 30 to 40% lower than the similar hospitals in this sector. Yeah, for a resource-strapped hospital like ours, the challenge to create an infrastructure and the cost of infrastructure is prohibitive, especially since the regulatory authorities demand nowadays that we should do fire compliance, environmental norms, which require a lot of investment which we can ill afford. Along with this, the challenge for us has been to meet patients' expectations by providing a wow factor, by creating modern amenities, but at the same time keep our heritage look and our greenery intact, which is what we aspire to achieve in this hospital. Our workforce has got people who have been working for many years and who have developed a kind of excellent work ethic, because of which many patients like to come again and again, because they find that our staff is very friendly and create a homely environment for the patients, which is what I think is the ideal mix that we would like to achieve. All our staff have been now aligned with the mission and vision of this hospital. And if you know, our vision statement is Masina wants to be the first choice for value and quality in healthcare, which is what my staff is working towards. See, we have a staff which is permanent, and we have got contractual staff also. There are certain areas where we are, especially in nursing, where we have a lot of attrition, and therefore it was very difficult for nurses to do the documentation. And in our HMIS system, the nurses' workbench was a underutilized aspect of the HMIS. In this context, we hired persons with disabilities from the Sujaya Foundation. Most of them were in the deaf and mute category, or some of them were persons with some physical disabilities. These persons had trained in data entry and are able to use the nurses' workbench, and they have gelled very effectively with the normal staff of our hospital and have become an indispensable part of our hospital. This is the kind of strategy in which we are serving society. At the same time, we are able to utilize workforce optimally, because the nurses their primary work is to do patient care, and by getting other people to do some of the other documentation tasks, the quality of care and the quality of nursing has improved dramatically. So Masina Hospital has just recently, Masina Hospital has got a 24/7 accident emergency department, which is very well located, close to the intensive care units and close to the operation theatre suites. And we also have a cath lab and a cardiac ICU, which is ready for 24/7 primary angiography for myocardial infarct, which many of the hospitals in the close vicinity are not able to provide.